Ladies and gentlemen, greeting from Houston, Texas. It is a pleasure being with you virtually and present this talk about gamification of exercise. As a short introduction about myself, I'm a Professor Bijan Najafi and currently serving as professor in the Department of Surgery at Baylor College of Medicine, Director of Clinical Research at the Division of Vascular Surgery and Endovascular Therapy, and co-director of National Science Foundation Center to Stream Healthcare in Place, or C2SHIP. I'm very grateful to the World Union Wound Healing Societies to give me the opportunity to deliver this talk today. In next 15 minutes, I'm hoping to cover two topics. First, I will discuss about the gaps in the field of exercise for people with diabetes and limited mobility capacity. More specifically, I will focus on older patients undergoing hemodialysis process. Then I will discuss about opportunities of technology and gamification of exercise to address some of the limitations of conventional exercise program. As you know, individuals with diabetes who are undergoing hemodialysis are known to have a decreased ability to perform physical exercise, with exercise capacity reported to be 60 to 70% of age expected levels, leading to impaired physical functioning, muscle wasting, frailty at early age, and also poor outcomes. Several studies have demonstrated that exercise training can improve balance and reduce depression, and leading to better outcomes and lower adverse events like falls or frailty. Recent evidence also suggests that exercise can increase in joint mobility and improve peripheral blood flow, which in turn can reduce risk of foot complication in patients with diabetes receiving hemodialysis. In other words, exercise is the best medicine. However, uptake of exercise programs for this patient population have been limited. The three main factors limiting uptake and adherence among hemodialysis patients are time availability, post-dialysis fatigue, and transportation problems to exercise programs, which are usually offered in rehabilitation departments or cardiovascular centers, but not in nephrology departments or in freestanding dialysis clinic. So to improve exercise in this population, more personalized exercise programs are needed. Hemodialysis patients are required to visit a dialysis clinic 3 times per week and spend 4 hours each time sitting or lying on bed to receive hemodialysis treatment. This facilitates a perfect opportunity to provide low-intensity, non-weight bearing intradialytic exercise to this patient population. Several studies actually demonstrated the feasibility and effectiveness of this kind of exercise, some of them shown here to reduce depression and improve the outcomes. In these studies, however, exercise trainers or nurse staff were required to be present during the whole exercise process to give instructions and guide the patient. However, in real world, a non-research institution, it is impractical to have an exercise trainer present in the dialysis clinic to guide each patient through the exercise. Having nursing staff administrate each exercise session for each hemodialysis patient is also impractical, which could easily overload already overburdened nursing staff in dialysis clinic. This may explain the limited uptake of intradialytic exercise program. For example, in US, as shown in this graph, only 20% of hemodialysis clinics currently offer exercise to their patient population. Here, it becomes the role of technology and maybe gamification to address that limitation. Another major limitation that we need to consider for conventional exercise program is lack of cognitive exercise component. Several studies like ours have shown that exercise programs that include cognitive exercise like Tai Chi it could be more effective than non-cognitive based exercise, in particular for people with neurological disorders like stroke survivors. At the same time, if you look at the rate of cognitive decline among hemodialysis patient with diabetes, this prevalence could be pretty high. For example, in one of our recent publications published in 2020, plus one, we observed that over 36% of hemodialysis patients with diabetes have cognitive impairment. This may indicate that a suitable exercise program for this patient population should include cognitive component of exercise. Obviously, Tai Chi or other weight-bearing exercise may not be suitable, but maybe we can use game to incorporate this cognitive component. So if I summarize, the conventional exercise have several limitations for people with diabetes and limited mobility, like hemodialysis patient I described it earlier. The main limitations highlighted here include inability to regularly commute to rehabilitation center, poor adherence to regular exercise, unable to do high intensity exercise and it may overtax them, and lack of cognitive exercise program. Gamification and telemedicine may address some of these limitations by providing exercise in place. That means that in clinic or in home, providing both digital and remote coaching of the exercise to reduce the need of having nursing staff to oversee all those exercise and ensuring that patient can do correctly these exercise tasks. Also, we can use gamification to incorporate the cognitive exercise like metaverse, as well as personalized exercise like a game. When the patient masters one level of a game, then we can add more complex level of the exercise to the patient. So how we can do it? So let's look at one of the typical example of exercise, like foot and ankle exercise. Dorsiflexion and plantar flexion exercise have been shown to be effective and beneficial for diabetes patients with diabetic foot problem. So how we can gamify this exercise? These are one example of the game that we developed. For instance, we can use a space shooter game. That means that we can navigate a space shooter and hit a series of the target on the screen. So how we can play that game? Maybe by rotation of the foot in medial lateral direction, we can bringing the space shooter on left and right, and by dorsiflexion and plantar flexion, we can hit the object. This could be one scenario of the game. The second scenario could be Flying Bear, this popular game. I'm guessing that maybe some of you play that game. So here in this game, we just can do dorsiflexion, plantar flexion. For instance, when we are doing dorsiflexion, maybe the bird flying high. And when we are doing, for example, plantar flexion, the bird flying down, and then we can navigate through a series of the obstacles. And simply we can add a sensor to foot, it's an inertial sensor that can act like joystick to play that game. So how it works and whether it's effective. Actually, we show the effectiveness of this sensor. Here is, for example, example of a space shooter that I explained it early. So by rotation of the foot in medial lateral, as you probably see here, the space shooter move to left and right, and by doing dorsiflexion, plantar flexion, we can hit the target. So at the same time, we place some EMG sensor on the calf muscles, and on the tablet that you see next to the on the computer laptop that we place next to the tablet, you can see the signal of EMG. So this simple exercise is pretty effective to activate calf muscles. This is the Flying Bird, again, the same thing. But as you notice here, even is more challenging exercise. And the EMG signal, as you see on computer laptop, it is much more intensive than space shooter. Why? Because in that case, when the patient doing, for example, dorsiflexion, they need to hold on certain position, therefore constantly activate the calf muscle. We can, like a game, adding more level of complexity when the patient can master the other exercise. Here, for example, we incorporated biking. So it's the same Flying Birds, but Now for playing this exercise, the patient pedaling fast, so we pedal faster, the bird quicker going up, and when they stop pedaling, the bird is flying down, and we can add other kind of the exercise, like for example, knee exercise in this example. We validated the benefit of this kind of exercise for this patient population. For example, in a paper that we published in Journal of Vascular Surgery, we demonstrate that these flexion extension of the foot exercise is effective to improve perfusion and venous return flow. Here we use a Doppler and we look at, for instance, the flow volume increased 49% by just 3 minutes of playing that game. In another study, we designed a randomized controlled trial in which we compare this exercise compared to supervised exercise providing in the dialysis clinic. And we explore a series of the outcomes, including gait, balance, physical activity, and depression. What we observed was very interesting. We find out that there is a significant reduction in depression symptoms by 37% among this population with medium effect size. This level of the decline in depression is equivalent of the similar level of depression and reduction in depression that we observed during supervised exercise. But the advance here is that you don't need to have a nursing staff be present to administer that exercise. That can be fully managed and virtually coached by the technology using this Exergain tablet that I explained earlier on. We are in the phase of publishing the results about the outcomes. For instance, also we observed that when we are coaching the exercise, actually the acceptability of the exercise can be improved, and also we can improve some of the functional outcomes like balance, gait, and physical activity. So in summary, I believe that you are agree with me that exercise is medicine, and I believe that is not only medicine, it's the best medicine, and we need to encourage our patient to continue to do the exercise. The reality here is that uptake of exercise among patient population is limited. Maybe by gamification of the exercise and benefit of the technology, we can provide a practical exercise mimicking the real evidence-based exercise that's shown to be effective, and provide this exercise to a patient population. This kind of exercise can be done at home and can be done in clinic. By adding telemedicine, like the use of the tablets that we are showing here, even we can offer the remote education of the exercise. We have ongoing study that currently we are trying this component as well for post-COVID patient. With that, thank you so much for listening to my talk. I would like to take opportunity to acknowledge my team. Here is the photo that I took just before pandemic. They did most of these works. I also so grateful for WHS committee to give me the opportunity to present this talk. Thank you so much, and enjoy the rest of the meeting in Abu Dhabi.